I just want to use this opportunity to introduce our speaker for today, Dr. Nuvie Oyeyemi. Dr. Nuvie is a consultant, obstetrician, and gynecologist at the Federal Medical Center, Yenagoa. She's also a part-time private practice with Crest Consultant Hospital and Fertility Care, Campesia. She also practices as Oasis Public Health Consulting at Yenagoa. She is a 2002 MBBS graduate of the prestigious University of Ibadan. She was awarded her fellowship in the West African College of Surgeons and National Postgraduate Medical College of Nigeria, Faculty of Obstetrics and Gynecology. When she completed her residency and 5-year training in Lagos State Teaching Hospital, she also got a master's degree in public health in 2014 from the College of Medicine, University of Lagos, after which she commenced her private practice and took up her appointment as a consultant in FFC. She has attended numerous local and international conferences, courses, and trainings. She has attended as a trainee, a trainer, and a trainer of the trainers. These include, amongst others, a leadership course with the Nehemiah Leadership Institution in 2021. She served as the head of Department of Obstetrics and Gynecology, FMC Yenagoa. In her tenure from June 2019 to June 2021, she made various oral, poster, and paper presentations at local and international conferences of Society of Gynecology and Obstetrics of Nigeria. She has published various papers in peer-reviewed local and international journals. She has been given, she's given numerous public lectures on general public, sexual and reproductive health matters, especially women's health. She has co-authored in books, Menstruation, Let's Talk About It, 2014, Synopsis of Emergency Cases of House Officers, at FMC Yenagoa. She's involved with training, supervising medical students, pre-registration of house officers, and resident doctors specializing in obstetrics and gynecology. She is the facility-based coordinator for maternal and prenatal death surveillance and response community. She is a coordinator of prevention of mother-to-child transmission of HIV programs in FMC Yenagoa. She's a state focal person for family planning activities and training in Bayelsa State, and she has received various awards of excellence in different capacities, especially in her field of endeavor. She is a hardworking wife and mother who loves to spend quality time with her family. I want us to give it up for Dr. Oyeyemi. Dr. Oyeyemi, a very big thank you for joining this session. We're hearing that you're just coming out from the theater and you found your way to make it to this session. A very big thank you. We really, really do appreciate it. And over to Dr. Oyeyemi.
Okay, thank you. Good afternoon, everybody, once more. We are presenting respectful maternity care through the patient's lens. Under these outlines, what is respectful maternity care? What is disrespectful maternity care? Predisposing factors to disrespectful maternity care. Domains of disrespectful maternity care. Importance of respectful maternity care. Then respectful maternity care through the patient's lens. Disrespectful maternity care through the patient's lens. How to achieve respectful maternity care. Interventions, and then challenges of respectful maternity care. And then actions to prevent and eliminate disrespectful and abuse during facility-based childbirth. And then implementations of respectful maternity care policies and actions. And then we conclude. So we have a logo here on respectful maternity care. The universal rights of childbearing women is actually a universal right. Next slide, please. What is respectful maternity care? By definition, you can say it's an organized care for and provided to all women in a manner that maintains their dignity, privacy, and confidentiality. It ensures freedom from harm and mistreatment and enables informed choice and continuous support during labor and delivery, childbirth. Next slide, please. Before we go on, we are going to view a video. Okay, let's just start with this illustration about human beings generally. We have feelings and emotions. We all feel pain and we feel joy, we feel as well as feeling hurt. We bleed when we cut ourselves. Yes. And we want to work to provide for ourselves. And we want to be respected and treated with respect, both at work, in our private, in public places, in our families, in everywhere. So also a woman during maternity care and childbirth wants to be treated with respect. Next slide, please. Now, we need to understand what respectful maternity care is. Let's quickly go through this video. It's a short video just to illustrate for us to have the basic understanding of what respectful maternity care is. Thank you. Let's just go through the video.
It is morning at the health center, and Mama has arrived to have her baby. She's feeling nervous about what to expect. Aziza and Sarah are two of the health workers at the center. Aziza is a trainee health worker who is learning about respectful care. Sarah has worked at the health center for a long time and is helping Aziza to learn. Mama comes from a different village. Aziza is not sure whether she's allowed into the clinic, but Sarah encourages Aziza to welcome Mama. All women are welcome at the health center. Wherever they come from, Mama has a right to be treated equally. Mama wants her mother to stay with her. It can be very helpful to have support and comfort. Mama has a right to have a companion. The health center is busy, and Mama is worried about giving birth in front of others. Aziza uses a cloth which covers her. Mama has the right to privacy and confidentiality. Aziza needs to check Mama's blood pressure. Mama feels scared. She does not understand what is happening. Aziza asks Mama for permission, explains what she's doing, and that her blood pressure is fine. Mama has a right to all information about her treatment and the right to make a choice. As Mama's labor gets stronger, Aziza raises her voice. She shakes Mama and shouts at her to push. She wants the baby to be born quickly. Sarah shows that it is important to be gentle. Mama has a right to be treated with respect and dignity, and to be free from harm. Shouting and pushing can be stressful for her and her baby. They work together to help Mama through labor. Mama is uncomfortable and wants to change her position. Mama has a right to make a choice, and Aziza helps her to do this. Aziza sees the scissors that will cut the baby's cord are unclean. Using clean equipment gives Mama a safe and healthy birth. Mama has a right to the best available treatment. At last, Mama gives birth to a lovely, healthy baby. The baby is put skin to skin with Mama to breastfeed. Mama is very happy. Aziza and Sarah are happy too. The next day, Mama and her baby are ready to leave. Mama does not have enough money to pay for her treatment, but promises to pay soon. Mama and her baby have a right to leave. She cannot be held against her will. Aziza is pleased that she has learnt about respectful maternity care and how important it is. She's looking forward to doing the same for all future mamas who come to the health center. Mama thanks Aziza and Sarah for helping her to give birth to her beautiful baby. She'll come back to the health center in 2 days for a checkup. Mama showed courage by coming to the health center, and she feels she was treated with respect and compassion during her birth, and she'll tell her friends about the care she was given.
All right, thank you very much. So let's go on with the presentation. I hope we can all hear.
Yes, yes.
Good, okay. So what is respectful maternity care? It is organized care for all women in a way that maintains their dignity and control, the privacy and confidentiality. It ensures freedom from harm and mistreatment. It enables informed consent, informed choice, and continuous support throughout the labor process and delivery. It is equitable and dignified healthcare for all women, and it enables women to participate in decisions that affect their reproductive health and the health of their babies. It's inclusive and is a good quality obstetric care. Next slide, please. Yes, it promotes the rights. Every woman has a right to respectful maternity care. So this is just the logo to show that. Next slide, please. Now, before we go on with respectful maternity care, let's know what disrespectful maternity care is. Because without knowing that, we may not be able to understand fully what respectful maternity care is. So what is disrespectful maternity care? It is care that lacks privacy in a facility. It lacks supportive attendance during labor and childbirth. It subjects the woman to excessive number of intrusive vaginal examinations. It gives the woman threats of episiotomy and cesarean section, like threatening her frequently. If you don't behave well, we'll take you for CSO, take you for CSO. That is disrespectful maternity care. It involves physical abuse, verbal abuse, and non-consented care. Don't ask for consent before vaginal examination or before particular procedures, setting a line, all of that. That's disrespectful maternity care. It's non-confidential and it's non-dignifying. There's stigmatization and discrimination based on specific patient attributes, like you have a teenager in labor and you're abusing her when you are supposed to be in school. You are here, you know, all of that. Judgmental attitudes during maternity care, abandonment of care, or threat of abandonment. I'll leave you alone if you don't cooperate. All that is disrespectful maternity care. And then detention in facilities when she's not able to pay her bills at the end of the care is also termed disrespectful maternity care. Next slide, please. Now, what are the predisposing factors to disrespectful maternity care? Well, these are just risk factors, things that increase a woman's chance of being exposed to disrespectful maternity care. Low socioeconomic status and lack of education of the woman. When the woman is not empowered, there's sociocultural norms, then economic and professional barriers, weak health systems, when there's lack of rules and regulations in the healthcare system on how to treat care or how to treat patients. Lack of training and retraining of the health workforce, because part of it is customer service. The workforce, the members of staff need to be trained frequently on customer service. Lack of supervision, monitoring and evaluation in the healthcare system. Lack of accountability. Most of the time, we're not accountable to our actions. This can predispose to disrespectful maternity care. Then limited legal redress mechanisms. These are predisposing factors to distress when there's no freedom and there's no free access to legal redress when there's a breach in care. Now, what are the domains of respectful maternity care? Freedom from harm and mistreatment, maintenance of privacy and confidentiality, preserving the woman's dignity, prospective provision of information, and seeking informed consent at all stages, ensuring continuous access to family and community support. There are actually 12 domains. Then enhancing quality of the physical environment and resources. Next slide, please. There are 6 small domains. Next slide, please. Providing equitable maternity care, engaging with effective communication, respecting women's choices that strengthens their capabilities to give birth, availability of competent and motivated human resources, that's the healthcare staff, skilled birth attendants who have empathy and the right attitude, provision of effective and efficient care, and then continuity of care. These are the 12 domains of respectful maternity care. Next slide, please. So what are the importance of respectful maternity care? Yes, the women feel safe, they feel supported, respected, and they're able to participate in both their care and decision making. And they are more likely to have a more positive childbirth experience. It gives them a positive childbirth experience. It also influences future choice concerning accessing facilities with skilled birth attendants. So it helps to keep them with skilled birth attendants rather than driving them out to the traditional birth attendants that are unskilled. Women will share their birth experiences with other women and also influence the choice of these women in accessing maternity care. Then generally, respectful maternity care improves the health-seeking behaviors of women. It helps to improve it, and it will reduce significantly the incidence of litigations, because if women are properly treated respectfully during their maternity care, irrespective of the outcome, it's better for them to know that the healthcare is easier to know that the healthcare professionals or healthcare givers have tried their best. So it helps to, and this will help to reduce the stress on the healthcare system. It ultimately will reduce maternal morbidity and mortality, because when women are treated respectfully during their care, maternity care and childbirth, we are likely to get better outcomes to reduce morbidity and mortality. Next slide, please. Now, through the patient's lens, how does the patient view respectful maternity care? They feel safe and secure. It gives them dignity and they are in control of their care. They feel included and engaged in order to optimize access to the use of available care. This will help to optimize that because they feel that they are included in the care and they are engaged in the process. There's also a willingness to choose. It makes them willing causes them to be willingly choose access and access health facilities during childbirth. So they view childbirth as something that should be done in a health facility if they are respectfully treated. Then they feel that their human rights are upheld. There's good communication, they feel, and information is passed, so they feel informed and they appreciate the care. So women appreciate care that respects their culture, their values, and their beliefs. Next slide, please. Now, how do they view disrespectful maternity care? Yes, some practices are viewed as very discomforting. These are practices that we have in disrespectful matters, very discomforting and dehumanizing. The frequent intrusive vaginal examinations, then the verbal abuse, saying, were we there when you were doing it? You know, all those comments, they view them as very dehumanizing. Yes, and threats. They look at the disrespectful maternity care as threatening, threats and fear of being caught. Like when we threaten, say, okay, we'll give you a cut if you don't push properly, we'll cut you or we'll take you for CS. You know, they view them as threats and it instills fear in them. Lack of patience, they view the healthcare, the workforce as lacking patience and empathy. That's the way they view the skilled birth attendants when we offer them disrespectful maternity care. And then they view the health workers as ones with poor attitude and hostile to them. And healthcare providers are viewed as rude, bossy, insulting, easily provoked, and lacking compassion. And they feel neglected in all of this. So those are the way the patient views disrespectful maternity care. Now, next slide, please. Then how do we achieve respectful maternity care? Well, these are the interventions by staff training in the values and attitudes, which can cause actually transformations in their attitudes and in their values. Training in interpersonal communication skills. That's where this training and retraining comes in. Training and retraining of the workforce, the healthcare workforce on customer service, client service, setting up of quality improvement teams that can go around and ensure improvement of quality of care and maintenance of standards of quality of care. Then the monitoring and evaluation teams who can monitor and evaluate what our obstetric quality of care is. Then staff mentorship, like what we saw in the video. You know, the older one was mentoring the younger one coming in on how to practice this respectful maternity care. Then improving privacy in wards, like use of curtains. We saw it in the video in our labor wards, curtains and barricades, so that the patient can feel that their privacy is being respected. Then improving staff conditions. Yes, that's very important. Improving working conditions and staff general conditions can also help us to achieve respectful maternity care. And now, other interventions, holding facility and community workshops, then holding maternity open day, where you have those who have benefited from respectful maternity, in fact, general maternity care, coming in with the healthcare givers, having interactions. Then mediation and alternative dispute resolutions. When there's mediation, there's an avenue where both the patient who has been treated disrespectfully and then the workforce, they interface with the dispute resolution team. The interventions to achieve respectful maternity care. So we talked about, we're on mediation and dispute resolution, and then counseling of community members who have experienced disrespectful maternity care and abuse. Then providing means of submitting complaints, like we have the Navihealth platform for complaints and suggestions, and also suggestion box in the clinics and in the labor rooms and all of that. So the Navihealth, that's where we're there, and that's where we are. So thank God we are here. We'll hear more about them. So it's a way of submitting complaints and having them remain on their rights, because respectful maternity care is a fundamental human rights of women. And then companionship during labor and childbirth. Companionship during this will help us to achieve respectful maternity care. Next slide, please. Challenges to respectful maternity care. Yes, the misconceptions we have and misgivings. Some healthcare staff, they see mistreatment and physical abuse during labor and childbirth as acceptable and necessary to gain compliance from the woman. Misconception: when the woman is slapped into compliance, the outcome will be good, like the one they call the obstetric slap, when they slap the woman to position herself well. That is abuse. That is physical abuse and is disrespectful maternity care. Some women see mistreatment also. That's also a misconception on the side of the women. They see mistreatment as just a reality of childbirth in a health facility. That's a challenge to respectful maternity care, because it shouldn't be seen as a reality. It is disrespectful maternity care. Then lack of care for caregivers like doctors, midwives, nurses, and other healthcare providers. When they feel not cared for, they are impatient and they tend not to treat the patients well. Then lack of appropriate remuneration for and working conditions in the healthcare system. This can be a challenge to respectful maternity care. Lack of respect and value for healthcare workers can also be a challenge to care. The lack of appropriate in the healthcare system, like this, cannot be overemphasized. We have emphasized it before, about continued medical education, training and retraining, and then lack of gender and health equity. Next slide, please. Those are challenges to respectful maternity care. Next slide, please. Next slide, please. Yes, actions to prevent and eliminate disrespect and abuse during facility-based childbirth. These extracted from a World Health Organization statement. 1, greater support from government and development partners for research and action on disrespect and abuse during maternity care. Initiates, support, and sustain programs designed to improve the quality of maternal health care, with a strong focus on respectful care as an essential component of quality obstetric care. Then emphasizing the rights of women to dignified, respectful health care throughout pregnancy and childbirth. This should be emphasized. It cannot be overemphasized. It's the right of a woman to have dignified, respectful health care throughout pregnancy and during labor and during childbirth. Generating data related to respectful and disrespectful care practices. This can also help. These are part of the actions to prevent and eliminate disrespectful maternity care and abuse. Yes, and putting in systems of accountability and meaningful professional support as required. Then involve all stakeholders, including the women. Yes, the women, their significant others, their caregivers, in efforts to improve quality of care and eliminate disrespect and abusive practices. Then implementing respectful care policies and actions. 1, governments It's at the level of the government, at the level of the healthcare system, their commitment, and at the user level. Now, for the government, we've already mentioned some, just making sure that the healthcare facilities are well equipped, and then making provisions for the training, retraining of, and then for the health system itself, providing a conducive environment that ensures privacy and confidentiality for the women, and also training and retraining of their staff on respectful maternity care. Now, community level sensitization activities undertaken to disseminate information is also a way of implementing respectful care policies and actions. The respectful maternity care should be seen as a fundamental human right of pregnant women and babies in facilities. The facility-based practices that lead to improvement in women's childbirth experience, like effective communication choices, effective communication during labor, during delivery, then choice of birth positions. The woman should also be allowed, because there are different, the flexibility. In fact, this is a health system commitment, being able to put in measures that can allow women have a flexible birth position. Yes, because there are different positions, but some health systems are glued. They are more rigid. Yes, asking her to lie down, that she must lie down. This should be made flexible, and it's from the health system commitment to respectful maternity care. Then choice of pain relief, yes, in the part of the healthcare givers and also the health system having their guidelines on pain relief during labor. Then unnecessary birth practices that are not recommended for healthy pregnant women, that are should no longer be practiced in facilities. These are like using episiotomy liberally. That episiotomy is the cut that we give during childbirth. It shouldn't be something routine anymore. It should be given when required, And then rupture of membranes, artificial rupture of membranes, may not be routine, doesn't have to be routine. And some other practices, they don't have to be routine. These are unnecessary birth practices that not necessarily do not improve outcome, but yet are disrespectful to the woman. Now, in conclusion, respectful maternity care is a fundamental component of quality obstetric care, which is inclusive and it's not only clinically safe, but also emotionally and psychologically safe for the woman and her family. The care must include respect, community knowledge and values, and it must be tailored to women's needs, and very importantly, provided by healthcare providers who can combine both clinical knowledge and skills with interpersonal and sociocultural competence. Thank you very much.
Very much. It's very important, very much needed, very, very insightful. And for us as implementing partners and also the Project Aisha participating facility, this is really just, the fundamental of what we are trying to preach.